Thanks, Athena. She's being quite modest. She's an extraordinary executive director. We're very thankful. She's come on, I guess, for a little over a year, and we've grown substantially, and she's handled it all in quite a wonderful stride. So we thank you for everything you do for us, Athena. All right, so without further ado, it's my pleasure today to be opening up our third installment in our Conversations with Community Leaders discussion panel. So my name is Dr. Joseph Guillory. I'm a UT Southwestern psychiatrist. I got involved with NAMI in strictly a volunteer basis in the efforts of trying to get to know the people I serve outside of the clinical setting, truly getting to know them in their lives, their achievements, their trials and their triumphs as well. And here I find myself as a member of the board of directors today and the current chair of our strategic planning committee. So in our mission, we truly try as a board to serve our community in all facets. And this idea came up when we were talking about how better to engage the community than being able to engage its leaders. And so we started this conversation series in hopes of being able to get to know who we believe are trailblazers in the field of mental health. So this is the third installment, as I previously stated, and it focuses on the topic of mental health and public policy. So before I hand it over to our wonderfully capable moderators, I'll just go through and do a couple introductions for our board members that are part of the meeting. So the first up is Nicole Bowers. So she is an LCSW. She has done wonderful things in the field of mental health. She currently serves as the mental health coordinator for the Plano Police Department and has been a board member for how many years, Nicole, now?
I started back with NAMI County, so almost 7 years.
Wonderful. Seven strong years. Okay. Next up is our current president, Officer Todd Guillory. He's the president of NAMI North Texas Board of Directors. He's an 18-year veteran of Garland Police Department. He serves in a mental health liaison role. He's also an instructor of CIT and mental health first aid. He also participates in law enforcement resiliency as an advocate, does a CISM, a peer-to-peer team. He's a peer-to-peer team member and engages in traditional and non-traditional therapy as an advocate. Next up is Elise Ferguson. So, hello, Elise. Elise currently is the chief attorney at Collin County Mental Health Managed Counsel. She's a commissioner for the Judicial Commission on Mental Health. She serves as well as the chairman for the Mental Health Committee, Texas Criminal Defense Lawyers Association, and works closely with attorneys, local law enforcement, and community resources to decrease time in the criminal justice system and engage individuals with community resources. Elise Ferguson. And then our last board member in attendance that is not an executive director or a moderator is Claudia Smith. Claudia has been working in the F&B business for the past 38 years. She has one daughter and 9 brothers and sisters. She has been involved with NAMI for the past 8 years and currently concurrently been the backbone of our outreach to the Hispanic patient population. She has a direct line to anyone that may be in crisis or in need of support so that they can access her directly, and she supports them in extraordinary ways, very knowledgeable, very experienced, and she's a family Spanish teacher. Alrighty, so those are our board members in attendance that aren't moderators. So then I'll go on to our moderators. So first up is Phyllis Finley. She graduated from the University of North Texas with a BA in sociology and a minor in psychology. She's worked in human services for over 30 years and at Denton County MH&MR Center for the last 27 years. She has extensive and varied experience alongside individuals with developmental disabilities as well as individuals with mental illness. Phyllis currently serves as the Community Outreach Coordinator At the center, this position is devoted full-time to marketing and providing the National Council's Mental Health First Aid Training Program. To the staff of Denton County, ISDs, charter schools, trade schools, universities, community colleges, as well as the general community through collaboration and partnerships. We have had the pleasure of having her join our board within the last year, and we're very, very happy to have her on board and continuing the work that she continues to do. Thank you for joining us as a moderator today, Phyllis. And then last, our second moderator is Sherry Kusamano. So Sherry is an RN. She has an LCDC as well as an MS and Administrative Director of Community Education and Clinical Development at Medical City Green Oaks. She served on the local NAMI boards for 15 years and currently serving as a volunteer for NAMI North Texas and NAMI Texas. She hasn't included this in her bio, but she's our outgoing president. So she just left us, but in good hands, no doubt. She's a mental health first aid instructor, a member of the Dallas-Fort Worth Hospital Council's Mental Health First Aid Subcommittee, and is the chair of the Community Healthcare Collaborative for the DFW Hospital Council Foundation. Currently, she serves on the board of the Coalition for Behavioral Healthcare in Collin County. She received an AA in nursing from Johnson County Community College, a BA in counseling from Ottawa University, a BSN from Jacksonville University, and an MS in healthcare management from the University of Texas at Dallas. So needless to say, we have a very overqualified moderator lineup for you guys today. So they were specifically chosen with their areas of expertise in the field, obviously, of mental health, but also in public policy. So we hope that our panelists today are able to engage in a way that they feel that this time is a great use of their investment and their ongoing efforts to aid the field of mental health. So without further ado, I'll pass it over to Phyllis and Sherry.
Well, hello, and I'm going to start out by introducing one of our guests. We are really excited. I've actually had the honor of meeting both of you, one of you face-to-face before COVID, and that was Senator Johnson, and then the other one virtually through Zoom, and that was Representative Johnson. So I'm thrilled to have both of you here. I'm going to introduce Senator Johnson, and then I will pass the baton and let Phyllis do the honors of the other introduction. Senator Johnson was elected with very strong bipartisanship in 2018 and represents the very diverse area of demographically diverse area of North Dallas County. He graduated magna cum laude with a degree in physics. I was very impressed to see that, from the University of Arizona, and earned his law degree from the University of Texas at Austin. He practices law in the trial practice group at the law firm of Thompson and Knight, and he also composed music for the classical concert stage and scored the hit television series Dragon Ball Z. So kind of a Renaissance person there. Senator Johnson has been very prolific in terms of drafting legislation and passing bills. His first legislative session, he passed 22 bills, all with bipartisan support. And he earned a reputation for being a quick study who convenes and considers the views of diverse constituencies and pursues creative public policy solutions. In 2019, he worked to ensure the passage of the Texas Child Mental Health Care Consortium, which has been important, I think, to all of us. Senator Johnson has filed many health-related proposals for the current legislative session, including the Live Well Texas program, which I'm very interested to hear more about later, which is Senate Bill 117. If passed, the measure would extend inpatient and outpatient behavioral health care coverage to approximately 1.5 million uninsured Texans. That's impressive. He also partnered with Big Thought, a DFW area nonprofit, to develop Senate Bill 123, which seeks to integrate social and emotional learning components into the K-12 curriculum standards. So that's one of the people we're going to get to speak with and pick his brain today. Thank you for being with us.
Well, it is my honor to meet both of y'all. I haven't gotten to meet you face to face, so it's a pleasure to get to see you all today. I get to introduce our Representative Julie Johnson, who was elected to the Texas House of Representatives in November of 2018. She represents House District 115 in Dallas County, which also includes the city of Coppell, Farmers Branch, Irving, Carrollton, Dallas, and Addison. During the 86th legislative session, Representative Johnson was appointed to the House Committee on Insurance and Judiciary and Civil Jurisprudence. Representative Johnson serves as the Vice Chair of the Women's Health Caucus and Treasurer of the LGBTQ Caucus. She's a member of the House Democratic Caucus, the Legislative Study Group, and the Sportsman's Caucus. In her first legislative session, Representative Johnson pushed for legislation that focused on consumer protection and access within our healthcare system. For her hardworking efforts during the 86th legislative session, Representative Johnson was named Freshman of the Year by Texas Monthly. Congratulations. When Representative Johnson is back home in the district, she is an attorney that specializes in personal injury cases, family law, and medication. She has represented thousands of clients in the DFW area and has been in practice since 1991. Representative Johnson grew up between Houston, Texas, and Auburn, Alabama, but she settled in Texas as soon as she could. Good. She attended the University of Texas at Austin and the University of Houston Law School. She is a mother to 2 teenage boys, and her wife, Dr. Susan Moster, I hope I got that right, is a gastroenterologist practicing in Fort Worth, Texas. So welcome, so glad to have you, Representative Johnson. I will start the questions, and these first few questions we will pause it to both of you, so whoever feels comfortable answering first, please do. So our first question that we would like for y'all to think about and answer, describe your views on mental health and the role public policy plays within it.
Nathan, kick it off.
Okay. I think my views on mental health would probably started to develop when I was a kid because my dad was a psychologist with the Veterans Administration. My mom was a social worker. So the subject of mental health was a frequent subject in our household. We didn't talk about it a lot. We usually were watching Wild Kingdom, but we were aware, I think, from an early age of the importance of mental health on your overall well-being and on your ability to participate and function in society, and in turn, the dependence of a functioning society on people who are mentally, are in a good place mentally, and the importance of mental health wellness. And unfortunately, it's only recently that mental health has started to garner attention in the public eye as having an importance roughly equivalent to what we have with physical health, right? No one thinks twice about a sprained wrist and going to the doctor for it, but if you're unhappy, that's your fault. So we're over that now, and there is a great deal more attention being paid nationwide, including Texas, although we're still pretty far behind. But we have yet to really squarely address the question of what is the role of public policy in mental health. We look to the market for a lot of solutions, and whether we're talking about gas to put in your car or sneakers to put on your feet or physical health care or mental health care, the role of the state is to examine what are the critical needs of society and of people. And if the market's not going to fix it, the state needs to step in. And if the market can fix it with help from the state sets up infrastructure. The state sets up rules and regulations so that private forces can come in and operate. And all of this in the healthcare space is one of the most interesting and important areas of public policy because it absolutely requires the participation of private sector providers in public sector infrastructure and policies and regulations. So it's an area that is underdeveloped and as yet requires a lot more attention than we've been giving it. And fortunately, I think we're on the front end of a change, a shift in thinking nationally and in the state as to the importance of mental health and the importance of the role of the state in developing a better way of supplying mental health services to our population.
Yeah, I mean, I completely agree. You know, I think the role of public policy is to do a couple things, is really to affect access and open up doors of opportunity, and then also a role of destigmatization, just the same way that Senator Johnson referred. And so, you know, I think it's really crucial for the state to take a leading role in this regard, to have sound public policy to improve access in a variety of ways. I'm sure we're going to discuss in greater detail on this call. But, you know, I think it's just very, very important that the state take a leadership role in this regard and be a good partner with the mental health community and affecting policies that need to happen.
Very good to hear. Thank you very much, both of you. I'm going to pass the baton to Sherry.
Okay. For either one of you, what is your perspective on healthcare disparities within the field of mental health care? And how do you think that those should be addressed?
Well, you know, obviously we have some critical problems in that regard, and sort of in preparation for this call, my staff pulled together some interesting statistics that I wasn't even aware of. I'm sure many of you probably may know, but I wasn't aware. But nearly 70% of the counties in Texas do not have a psychiatrist. That's a staggering number. Yeah. And 37% do not even have access to a psychologist. So 37% of our counties don't have access to any mental health provider at all. And of course, this, you know, really disproportionately affects low income and minority and rural Texans. And so clearly we have a lot of work to do in terms of improving our access. And I just don't think people are really aware of these statistics. And I think that's something that we need to do a better job of, both you guys as an organization in terms of educating the legislative body about how dire a situation it can be, and in our job being within the legislative opportunities to educate our colleagues. And so I just think that when you really put some paper to it and look at some of these statistics, it's just really staggering how vast the problem is. And, you know, I wasn't even aware that we had these psychological deserts. You know, we hear of food deserts and we hear of all these other kinds of lack of access to resource, but obviously we have mental health care deserts in the state. And I just wasn't aware of how vast the problem was, quite frankly.
And hi, Julie. Julie and I happen to be very good friends, and we've known each other for a long time, and we both have teenagers, and our teenagers knew each other when they were little kids. And so we're aware of teenage mental health and stress and things too in this environment. But we are both fortunate enough to live in an area that is not a psychological services desert. And I think it's a topic that's so seldom discussed that I think, as we said, most people aren't aware of the existence of disparities in mental health services. But they fall geographically, they fall along racial lines, and sometimes the racial lines are related to the geographic lines, and sometimes they're not. And particularly with the LGBTQ community, especially for youth, there's tremendous emotional strain. There's not a lot of parental support in some cases. And we have sometimes legal barriers to them obtaining services. And then when you just talk about income, if you look at Medicaid expansion, for example, that Julie and I both are pulling strongly for, and that's what my SB 117 is about.
Yay.
States that have expanded Medicaid have seen statistics that roughly a third of that expansion population, those new people who get coverage, need and are able to utilize routine mental health services. we're not talking about super acute services, and Texas and other states can do address things specifically with a program here and a program there, and that's very important and very good. But the broad disparity is not a subset of acute cases. It's people who can't afford coverage. And then you start running into racial issues and geographic issues that line up with that failure to provide routine care. So Medicaid expansion is certainly something we need to do. And then the other thing that's happening right now is we've been handling some of this through DSRIP, the disproportionate share, or no, I'm sorry, disproportionate district delivery system reform incentive program that's ending in Texas. It was billions of dollars we were getting from the federal government to try various innovative ways to deliver healthcare, including mental health. And those district mental health programs are going away. They might be replaced with this extension that we just got from the federal government on our old deal, but their fate is uncertain. And if we were to expand Medicaid, a lot of the good work that was done under DSRIP would have a place to go. So it's just another area where on a policy level, there are things that we can do.
Thank you both.
All right, next question is, at this upcoming legislative session, what would you say is the most important initiative for persons living with mental health conditions and their families?
Julie, we can just go back and forth.
Oh, sure.
If you want to go first.
Either way, I was just going to say, obviously, Medicaid expansion. I think that's clearly the number one priority. It was interesting. I had a meeting with the Speaker's office this past week. Each member comes in and we have a discussion about our priorities and what committees we might be interested in serving on and how we best see our integration into the House in the next session. And obviously we had a very lengthy discussion about healthcare, and Medicaid expansion was brought up because, we just can't call it Medicaid expansion. We're going to have to call it like something like the Texas solution or something like that, because Republicans won't vote for expansion. So y'all need to come up with another word. So I just thought that was kind of interesting. It's like they're fine for it as long as we call it something else. And so that's going to be interesting.
Texas.
To see how,
It's matter.
Well, Texas.
Exactly. So it's going to be interesting to see, but I do think that finally a lot of members of the rural Republicans in particular have really seen the hardships of not having this program in place for their rural care, and with hospitals closing in their districts and their constituents having to drive such a long way. And while I'm exceedingly proud to support Nathan in his bill, my big push, as many of you know, is telemedicine. And so I really want to see us having pay parity in telemedicine programs, have telemedicine apply to mental health with phone access, not just video. Because I believe, Sherry, I think we were on a panel together.
Yes.
And where we had this discussion, and something that I learned from that panel that was it really stuck with me about the need for that is just to the point that so many families may have one computer source or location, and let's say if the father needs to have a mental health check-in, they may not be comfortable having that visit in front of their kids, and when everyone's in a centralized room, and to have that opportunity to go into a private space to have that meeting with their mental health provider is critical. And so that bill, I think, will transcend access across the line. And I think both these bills in tandem with Medicaid expansion and then full telemedicine would really, really make a huge difference in terms of access to care for so many people.
And with so much attention finally on health in general and mental health in particular, I think this is a point where we can take what Julie's working on in telehealth, which I fully support, what I'm working on with Medicaid expansion, what many other things, social determinants of health, and a couple other things I'll mention. This is the time to not just do this thing or that thing or that thing, but these things work in complement. and they support each other. And every problem that one approach solves is one that we're not going to have to deal with later through another avenue. So we can also, by doing many things at once, we can lower the overall costs of our efforts, which is important in Texas. But in addition to Medicaid expansion and telehealth services, we have other problems that we could address in the legislative environment. It's been explained to me that we have a gap in the continuity of care and the continuum of care for mental health access. We have, for example, if you're having an acute mental health episode, suicidal ideation, and you need hospitalization, there really isn't a good step-down treatment facility option. And there are various reasons for that. It may involve licensure, it may involve funding, but people are literally having to go out of state for certain kinds of near-term treatment, non-acute but serious treatment. And we can probably pick that up with some changes to licensing models. The subject of interpersonal violence is closely related to mental health. It's also closely related to physical health. And when we alter the structure a little bit so that state having contracts with insurance providers who cover mental health services are able to engage in social determinants of health, if they can use some of their profits to reduce interpersonal violence, to provide mental health services, they end up saving money in the physical health space too, because no one on this call is unfamiliar with the fact that mental health problems lead to very serious physical health problems. A long way of saying there are social things that we can do that have effects on the physical outcomes, which have effects on cost and well-being.
Well, thank you both. That was terrific. And said a lot of things I was excited about there when you talk about expansion and telehealth. I think there is a lot of synergy with all of the things we're talking about. I agree.
Jerry, I forgot to mention the social and emotional learning piece.
Oh, yes.
Looking at, and this is for kids in the curriculum. Phone, be quiet. My phone thought I was talking to it. I wasn't. We do want to incorporate social and emotional learning into the schools. And the nice thing is that there has been some research done on this, and control group versus groups of kids that have had social and emotional learning skills woven into their curriculum have seen that test scores go up for the kids that are better able to manage their anxiety, their depression, their anger, their feelings generally. So again, taking care of people has reinforcing beneficial effects outside of mental health.
So is that, well, I guess we're going to talk later again about Senate Bill 123. Is that?
Sorry.
Well, I mean, is that the initiative you're talking about?
That's exactly what I'm talking about. Yes.
Okay. Yeah, I was real interested in hearing more about that. So we'll definitely come back to that. Many individuals who are living with mental health conditions and suffer from existing juvenile and adult justice system practices, many of them do, we know, end up in the justice system. So what are your views on the issues that exist within the current system and the approach to reconciling those?
Okay, I'll jump in. A lot of this is being done at the local level,
Yeah.
through the county DA office and through the city's office. But I'm trying to find my examples of two that are working really well up here in the Dallas area. But both of them rely to some extent, here they are, the Right Care program up here. It's a cooperation effort between Parkland Hospital, Dallas Police Department, Dallas Fire and Rescue, in which you dispatch a social worker along with the police that goes out on a call, maybe with a paramedic, and they're better able to handle, you've got people who are equipped to handle very specific situations as a team that can reduce problems with crime and improve mental health outcomes. But these are depending on, to some extent, grants from the state, and the state needs to continue to support those. There's also one done at the county level, and I mentioned Dist a little while earlier. This is federal funding matched with state funding to support some of these local mental health related to the criminal adult and youth justice systems. And that funding is going away. Its future is uncertain. And there was a new deal negotiated between Abbott and the Trump CMS administration that may supply the funding for it, but might not. So it's something that will require a great deal of cooperation and communication between local government and state government so that we can continue to work with the federal government to get funding for these things.
Yeah, and just to tack on, not to repeat everything Nathan just said, but you know, it's going to be really interesting to see how police departments restructure their roles and their call structures. You know, there's been a lot of call for that, and you know, there's quite a bit of criminal justice reform bills that are being filed that would, you know, force or strongly encourage police departments to staff up more mental health providers and do more partnering with that and take off some of that. So it's going to be interesting to see what cities do and communities do. I know that some of the police departments within my House district, which sits completely in Nathan's Senate seat, are taking a look at some of that right now, kind of based on some of the events that have happened in criminal justice issues. So I think that's going to be an interesting trend to watch to see what's going to happen within the police departments themselves.
And Julia raises a question on the political side of there's a state versus cities mentality going on right now. And if a city and a police department decide to reallocate certain resources with a leaning towards mental health, is that going to be construed as a cut to law enforcement, which will draw the ire of state leadership and all sorts of threats right now? So I think it's a kind of, at the local level, it might be a somewhat scary territory.
Right.
But with champions,
right. And I think that's something that I hope that your organization really prioritizes and pays attention to. Because, you know, Abbott is saying we're going to oppose any efforts to defund the police. But what happens if if within a city budget, if the police chief and the mental health staff decide they're going to reallocate 10% of a budget and take some of that workload off the police department and fill it in over there, you know, will they be able to do that? I mean, they're trying to pass legislation at the state level that would prohibit that sort of reallocation. And so I think that's something where organizations like yourselves need to just get it all up in there and make a fuss about it, because your voices are going to be important.
And
Thank you.
and let's be super clear, nobody's for defunding the police. But if the police have what is clearly a disturbance based on a mental health episode, and they decide instead of sending 2 police officers, they're going to send 1 police officer and one person from the social science profession, is that going to be viewed as defunding? Or is there some funny actuarial stuff we can move around in a spreadsheet to make it not?
Right.
Right.
Thank you both.
Yes, thank you. That's very relevant to where I live in Denton. They reallocated some open positions for mental health officers and staff that are going to be working in that kind of model that you're talking about. So that applies here. Thank you. All right, next question. With the induction of President Joe Biden complete, do you think that there will be much change in the House, Senate, or legislation? Why or why not?
Well, I think there's going to be, you know, what's going to be interesting is to see just how much politics is going to come in play here. We have some statewide leaders like Cruz and Paxton, and you know, and who are already committed to opposing anything that Biden proposes, regardless if it's reasonable, relevant, or helpful or not, just because of it's a democratically proposed initiative. And so I think it's going to depend on, you know, to what lengths they're willing to go to play those partisan games, and how much Abbott is going to play into that. And we'll have to see. And I guess obviously funding, as Nathan just referred to, is going to be a critical piece, and how much federal funding we're going to be able to draw down. And then, you know, we're going to have to put pressure on our national colleagues in Congress to really start passing some stuff to help healthcare in Texas. I think there's some federal things that can be done, some revisions to ERISA, some things, some other programs that have to be done on a federal level to allow the state to regulate health plans a little bit more, and some things like that we need to put some pressure on our federal partners so that we can have more control of that at the state level.
I would say that my pessimistic view is no, it's not going to make a difference. We might have more money available for certain projects, which would be good. And so my less pessimistic and somewhat optimistic element of this is that I think that concern for mental health and willingness to invest in it has a little bit more favor among conservatives than perhaps other areas of social spending. So while I don't think moving from a Trump administration to a Biden administration is going to do much about the way people in the Texas legislature think, we may see some more resources available. And I do think conservatives, liberals, whatever other labels you want to put on us, generally there is a push in favor of mental health funding. We saw it last session. Jane Nelson sponsored the Mental Health Consortium bill. We increased overall funding for mental health by more than $500 million. We're still too low. But I think the field itself has reason to be hopeful.
Mm-hmm. I do, I agree in that I think the field itself has reason to be hopeful. I think COVID, with having everyone's kids at home all the time and being at home with a troubled spouse all the time, and you don't get to escape the troubles within your home, I've realized has brought to bear for people how important mental health care is.
Thank you so much.
Well, yeah, thank you both. Kind of leads to the next question. Do you think that there is much interest among legislators? Let me kind of rephrase this next question. Other legislators locally to form like a mental health caucus?
I think there's a chance of that. Yes, it's an opportunity. Let's see. So one of the discussions I had in the Health and Human Services Committee last session, when Jane Nelson, fiscally very conservative, was sponsoring a $100 million investment in mental health for youth. And I asked the question of her witnesses and of her, actually, I think I asked the witnesses, do you think that by spending this $100 million, I'm actually going to save money? And they said, oh, yes, absolutely, absolutely. And Senator Nelson said, absolutely, absolutely. So if we can view mental health investments as not expenses, but investments in wellness that themselves reduce our costs and therefore pay for themselves, it's a really good move. And if we can get enough people of either party to look at it that way, we might see people coming together and viewing this space a little more holistically, thinking ahead of the session instead of during the session, working with you to develop proposals before the session starts, working with groups like Big Thought that has come and talked to us in our office, and people who've come talk to us about mental health for teens. Really give that momentum out there in the community a place to go in the form of a group of legislators that are working together on something. So long answer of way of saying yes.
It'd be great.
Yes, I agree.
Wonderful. Phyllis?
Yes. Okay. Well, how can we at NAMI North Texas assist you in your ongoing efforts and platforms? What can we do?
Well, I would just say, help organize your membership, obviously, help advocate for the bills that we have filed and other pro mental health legislation to our colleagues, help amplify us on social media. I'll go ahead and put in my shameless plug. If you don't follow me on Facebook, you need to, at Julie Johnson for Texas, and Twitter at Julie Johnson TX. And same thing with Nathan. What's your social media, Nathan?
Nathan for Texas.
There you go. And so, because we both post a lot about legislation that we're working on and issues that come up, and a lot of healthcare policy postings that you'll see and to help us amplify those messages, share those and send them out in social media. I think the more that the broader reach we can get on positive mental health care messaging across as multiple people as we can, again, it just helps to destigmatize mental health care and helps prioritize that. But just help us advocate and then come testify on our bills. Drop a card in support of our legislation. Let people know that your organization is fully supporting the work that we're doing. Those kinds of things are looked at. These statistics of what groups are supporting things are important. So get in there and, you know, do the official, yes, we're behind these, we're in support, come testify. And then get your groups to support the bill and call in and support members of the committee to get stuff passed out, and just, you know, sleeve rolled up advocacy.
Wonderful. Okay.
And the other aspect is y'all are the experts. We're the politicians, and we do our best to understand these issues. But y'all are going to have a greater understanding for a lot of these things than we are. And if you recognize a particular obstacle to getting something done, or the lack of a bridge that needs to be built, those are called bills. Bring them to us, come talk to us. And sometimes if we fix that one little thing, it opens up the door to fixing a great many things. And if we get 3 or 4 or 5 bills between Julie Johnson and Nathan Johnson that we're moving through, I mean, that's a spectacle. And a spectacle is good because it draws attention to the issue. So we have kind of a cumulative effect of getting little things done that then get big things done. So bring us information, I guess, is what I'm asking you to do. Of things that are working, things that have worked other places, of things that aren't working, of particular needs.
That's exactly right. You guys have the best bill ideas. You live and see. If we could just fix this one thing, oh Lord, it would be so easy. And you know, you have in us both branches of the legislative, both houses of the legislative branch, and are committed to help pushing through these important issues. So
let me give you an example. Last session, I don't remember who came to us with this bill, but it had to do with people admitting themselves into inpatient psychiatric care. And there were inconsistent regulatory schemes between the state government and the federal government. And it was causing a lot of delays, and it was causing people who were in great emotional distress to have to sit in a waiting room for 8 hours processing things, and then, you know, inappropriate admissions and discharges. And it was actually a pretty simple fix. It was hard as hell to explain it, but it was easy to fix. And somebody brought it to us. You know, I never would have thought of it, but people who are the professionals in that setting were able to say, look, this is just a little fix right here in this sentence.
yeah, ands, ors, and commas make a big difference.
And almost everybody liked the bill. Not everyone did, but enough did to pass it.
So I'm wondering if that was the one that had to do with, you know, you had a physician has to see a patient within so many, anyway. Yeah,
That's the one.
that was it. I remember that. That was I thought that was a good bill. Easy fix, yeah. I think we can do that. I think we can do that. Okay, I'm going to drill down on some things right now. First of all, with Senator Johnson, we have both Johnsons here, so that's kind of cool. But I had some, we actually had some questions about some specific bills that you did. So that's why I'm directing that to you, although Representative Johnson may have comments as well. Several of us, I think.
My comment, I'm sorry, is that all of Senator Johnson's bills are exquisite.
All right. Very cool.
Not that we're sucking up or buttering up or anything like that.
Nothing like that, no.
Try to help each other.
All exquisite.
We were looking at your Live Well Texas program, Senate Bill 117. And, you know, I really just wanted to learn, we wanted to learn a little more about what that's going to do specifically for mental health. And you kind of alluded to that early on, but I'd just like to hear a little bit more about that bill, if you don't mind.
The bill itself, don't tell anybody, it expands Medicaid. It's a Medicaid expansion by another name. and what we mean by Medicaid expansion is drawing down federal dollars under the Affordable Care Act. That's all it means. You have to go up to 138% of the federal poverty level. And if you do it, you get dollars at 90/10. Anything else is not Medicaid expansion and doesn't work financially. But per the comments of the speaker, while I don't think that the word Medicaid expansion is quite as toxic as people think it is, because now it's 2021, it's not 2012. That's just my opinion. And so long as legislators think it's a dangerous word, never mind what your constituents think. If legislators think it is, we have to call it something else. So SB 117 is a waiver from some of the normal rules of Medicaid expansion. It allows Texas to customize it, and in a way that we can legitimately say, this is not your old Medicaid expansion. This is a Texas way. We can legitimately, truly say that and draw down these dollars at 90/10. So as it relates to mental health, just start with the fact that it gives eligibility would be about 1.5 million with assumed take-up rate. We'll see 900,000, maybe 1 million people newly insured on this. What we've seen nationally is that roughly 1/3 of those people, that is the people who end up joining the ranks of the insured through a Medicaid expansion, are able to utilize mental health services that were not previously. Meanwhile, we have specific programs aimed at mental health on a smaller scale, perhaps more acute conditions or specific conditions that were conducted under the old district programs that are going away, that may or may not have a place to go. But the systems that were developed there are going to be completely unfunded unless we expand Medicaid. If we expand Medicaid, there's a place for those things to go. The other thing that, maybe this is a bit of a stretch, one of the most consistent beneficial effects of an ACA coverage expansion, see, I didn't say Medicaid expansion, throughout the nation, has been stabilizing of family household finances. Households aren't falling apart. That means there's fewer divorces, there's less interpersonal violence, there's fewer evictions, greater stability overall at home. That's kids who are in a better mental state when they go to school. So simply by expanding Medicaid, you directly and indirectly have a profound effect on the mental well-being of people in Texas, as well as their access to mental health care. It doesn't have a specific, this money is earmarked for mental health. But the overall expansion, that has to do with what we fund and how we fund it through our overall Medicaid program. That's not in this bill, but it is something that the legislature has an effect on.
All right, that's terrific. Thank you for that. As I was looking at that, and several of us were discussing that, I thought, okay, now I'm confused between this and Medicaid expansion, and you just explained that. Thank you so much.
Can I make it more confusing still? So we've unconfused. There's one other thing I really do want to put out there, because it is important, because this is confusing. Okay. There's Medicaid expansion. There's my plan, which is an 1115 waiver, which expands Medicaid. Exact same result, except we have a lot more control over it and can do some really cool, good things, which we've built into the bill. At the same time, my bill is an 1115 expansion waiver. Just recently, Texas got an 1115 waiver. It's not the same thing. There's an expansion waiver and there's a non-expansion waiver. We've been operating under a non-expansion waiver for 8.5 years. It's about to phase out. We just got a new 10-year non-expansion waiver. It ensures a total of 0 people. 0 people. It's a backstop. It's good that we got it. It takes care of some uncompensated care. It might help some specific programs. There's $500 million allocated specifically for mental health, but only for things like schizophrenia and some other very acute conditions. It doesn't cover things broadly. So whenever people are talking about Medicaid expansion or a Texas way or coverage expansion, don't let them think that we're done talking about it just because Texas got an 1115 waiver. That's a non-expansion waiver. We got to have the expansion waiver. It's the only thing that works. Everything else is funded at a different ratio, at a 60-40 ratio from the federal government. We won't make it. We'll lose money. At 90-10, with a real expansion pursuant to an 1115 waiver or otherwise, it's funded at 90-10, and we actually make money by doing it, which will give us more resources to take care of people, including mental health.
Yes, I definitely get that. Wonderful. Okay, now we can go back to what you alluded to earlier, Senate Bill 123. And we were very interested to hear more about that. So you already touched on that. Can you talk about how it is that the social and emotional skills will be included in the curriculum to build character trait, or how this works? It sounded exciting. I just would like to know more about how this would happen.
And I will do my best. This is another area where people who understand this at a profound level come to Julie or come to me and help and ask us to help them move it through. There's something called the Texas Essential Knowledge and Skills Curriculum. And we don't have a separate class in social and emotional learning, but we do have, there may be an opportunity in a class where the subject that's being taught overlaps with social and emotional skills that are going on in the classroom. I actually, to be honest, don't know exactly how it works. I know only that I've looked at the evidence that shows that it does work, and that the good people at Big Thought actually know it and study it and have done it and have seen the results. And they've got studies going back several years that show that it does work. But overall, what we're trying to do is get kids to recognize and understand their own emotions in the context of the classroom, to build supportive relationships, to show empathy for others, when difficult times come up, to be able to deal with it, so that it's not just an environment of A, B, C, D, E, F, here's your homework, but in the context of everything that's going on, help teachers and school counselors observe the students, recognize when there's difficulty, identify them, and help them deal with some of the social and emotional obstacles to success in the classroom, socially and academically.
Okay, so there's a curriculum for that.
There's an overall curriculum, and we want to take the social and emotional curriculum and weave it into that.
Okay, that makes sense. Thank you very much. And then I think you've really already addressed the other question we had for you. The concern was if the state was resistant to, which there has been resistance to Medicaid expansion. I know that both of you have been in favor of that. You've advocated for that, tried to make that happen. And yet, if there is resistance to that, do you think there would be a possibility for a more limited Medicaid expansion for behavioral?
No. There's only one way to do this. It's an APA drawdown. It's 90-10. There ain't nothing else. You do something limited, it's 60-40. Texas 2036 is an objective, nonpartisan think tank that's been looking at this stuff. Next week or the week after, they will be coming out with a series of tools, and you can move sliders around and make any assumptions that you want. But what it will show you is that if you take a more limited approach, it's going to cost about 100 times as much. Costs are going to go from like almost nothing to a lot when you take a more limited approach, because you move to this 60-40 match instead of the 90-10 match. My motto is 90-10 or failure. All this stuff of we're going to have like an isolated population, and maybe it's specifically we're just going to do mental health. That would be wonderful for mental health. But if that's all we do, I guarantee you it won't be broad. It'll be specific. It'll be very narrow, and you'll be left with, okay, that took care of 3% of our problem. It won't cover people generally. It won't provide basic day in, day out mental health services. There is not, this is not the time for incremental steps, experimenting with this. We've been doing that for 8 years.
Yeah.
Sorry, no is the answer. Got to do it.
Okay, thank you so much. Phyllis?
Yes. All right, I have a few questions for you, Representative Johnson. Do you think there's a potential for House Bill 411 to help youth with mental health conditions, homelessness, and physical disabilities?
You know, I really hope so. This is another one of those examples where somebody brought us a bill. And, you know, I filed this bill last session, and we just ran out of time. It's not that we didn't have support for it or people opposed to it. It passed out of committee, but we just ran out of time on the House calendar by the time we got it through. But basically, Texas is the only state that has their special education as ARD, admission, review, and dismissal, which has negative words, negative tones, negative comments, and we're the only state that calls it this, as opposed to an individualized education plan, which every other state calls it. And, and it just seems like we need to normalize the vernacular that we use when we're dealing with these programs. And it just brings Texas in conformity with more federal law and more of a collaborative environment with school districts and parents and stuff like that. So hopefully we'll be able to get this bill passed. We're certainly going to prioritize it. We filed it earlier this time. We have an earlier bill number. Hopefully we can get it through the process, but it just clears up a lot of confusion for people who are new to the state, who have had children in these programs in other states. It's just an easy it's a terminology bill, but it certainly does make a big impact for the special education community. And this was a priority bill for them, and we're excited to refile it.
Wonderful. Very positive. All right, thank you so much. Can you discuss House Bill 809 as it relates to authorizing the possession, use, cultivation, distribution, transportation, and delivery of cannabinoids for medical use in patients with PTSD?
Yeah, and again, this is a constituent of mine. He's a veteran, is very passionate about this issue. So many veterans are addicted to opioids. They've had traumatic injuries, traumatic experiences, serving overseas, seen terrible things, and they come back with PTSD. And I'm sure many of you in the mental health space have treat these folks and see them in various capacities. And so veterans get hooked on opioids. You know, they're part of the OxyContin craze. And apparently there's been 2 studies done that show that cannabis extension to PTSD treatment is very effective, and it has the non-addictive characteristics that opioids can have. And so this is a bill just to help expand the medicinal use of cannabis for PTSD patients. And so I have a lot of veterans that are going to come testify and support the bill. Would love to have y'all drop a card on the bill and have you guys come and testify as well as to the efficacy of these kinds of treatments in PTSD treatment and therapy, and what a positive impact it can have. So hopefully it'll get passed, and we'll see what happens. I think it passed. I don't remember the too many bills last time, but I think we got it passed. I know we got it out of committee, and I think we got it past the House, but it may have died in the Senate. I don't remember for sure.
I think you have better chances this year.
Pardon me?
I think you'll have better chances this year.
I hope so. I hope so. But this has a broad, it's nice when we get constituency groups that Republicans tend to really get excited about, you know, veterans and stuff like that, really advocating for a mental health care piece. Hopefully the convergence of our medical community and our veteran community can get enough support to get this thing through.
Wonderful, thank you. All right, so my last question for you, we are quite thankful for your House Bill 908, which seeks to provide increased coverage for early childhood intervention services. What was your vision behind this bill?
Well, you know, this is a bill that actually Representative Rick Miller, a Republican, who carried it, but he chose not to run for re-election. And so my staff really liked this bill and wanted to carry it on. And it basically requires private insurance to cover early childhood intervention services ages 0 to 3. And this, as you guys probably are aware, this time period is really key for children with issues to have achieved some key important developmental milestones, and to have these services available. And right now, private healthcare is not required to cover it. And, you know, I am committed to making sure health insurance works for Texas families and actually makes it easy to use in a variety of the body of legislation that I filed. And this just is one more piece of that to allow families to be able to access their private health insurance for this kind of work.
And for what it's worth, Julie has already kind of developed a reputation for expertise in the area of insurance. So insurance things, she's a really good place to start.
Good to know. Well, thank you so much, Representative Johnson. I appreciate you answering questions.
Thank both of you. And if you have any questions of us, feel free to ask before we wind down.
No, I mean, I think we've already kind of gone over it. We just need y'all's support. Your organization is a valued, trusted source. You have a lot of expertise, a lot of wisdom, and persuasive talking points on these important issues. And we just need you guys to be partners with us to help get this legislation passed.
Well, I, for one, know that both of you are in the middle of a very busy time, and I greatly appreciate both of you taking time out of your busy schedules to have a conversation with us about the things that are important to you about mental health, and to hear what our concerns are.
Thank you.
And Sherry, if you don't mind, maybe we can open it up to the rest of the board members to see if they have any questions to follow up on the eloquently explained answers by Representative Johnson and Senator Johnson. I can kick us off. So I actually have two. The first one is for Representative Johnson. I think we have talked about several of the kind of legislation you're interested in trying to pass, but we didn't have a chance to actually touch on the House Bill 5022. So I know you touched a bit on it earlier, but if you could just speak to it a bit further for us.
Oh, telehealth, our telehealth bill?
Right.
Yeah, it's, to me, it's one of my absolute priorities in this upcoming legislation is passing telehealth. I think that it will transform healthcare. It will transform how access that people have. It's just a win-win for the state and for the people of Texas. So for example, just even employment. So people may need to have a quick check-in with their psychiatrist to get their medication refilled, for example. Let's just take an example here. But normally when people have a doctor's appointment, they have to take off almost a half day of work. By the time they leave their office, drive to the appointment, get there, wait, have the appointment, by the time, it's an afternoon. And this says, hey, I just need to just check out for 15 minutes and go and have a quick call with my doctor and get back and remain in the workplace. So this is a small business, and chambers are all about this. Teachers have a real hard time getting access to care. This really helps them. And then patients and providers, people in rural access, hard to get to parts of the state. My wife is a gastroenterologist. I saw firsthand during COVID how she was able to stay in touch with her patients and treat them for people who were terrified to get out. Obviously, she treats an older population, people who are very concerned about COVID and their exposure. And so to be able to maintain the regularity of consults with their physicians on issues that need to be discussed and have that in a safe manner has been critical. And I think physicians and providers, they need to be compensated for the work and the education and the training that they've done. If you're going to expose somebody to liability for a televisit, then they need to be compensated for it. So, I just think it's a real important bill. And fortunately, it's getting a lot of momentum. I mean, it was the governor, by virtue of expanding his emergency orders for telehealth, forced medical practices to get their billing straightened out, get their EMR straightened out, to have to accommodate provisions for telehealth that got patients used to it. And people like it and they want to keep it. And I think we have a strong likelihood of getting it passed. There seems to be a lot of support across the aisle and at leadership to get a telehealth bill done. So I'm very excited about it.
I absolutely agree. As a psychiatrist, it is critical to be able to access, right, any and all people in need, depending on where they are, right, or what resources they have available to them. And to your point, I think this is the right time for it because we've been using it and being in really to some degree normalizing it. So I'm very, very excited about it. And I do truly hope that the momentum only continues to get stronger and stronger and we can get it through because we really like it, you know, being able to see all of our patients.
Right. The only opposition are the health plans because they're convinced that, you know, all you medical providers are going to commit gross amounts of fraud when you have telemedicine available.
As we like to do.
Yes, I know, that's your top priority, right? So it's just crazy. So your voices and having, you know, I would just love to see, you know, thousands and thousands of healthcare providers across the state log in and register their support for the bill. So, I mean, it would give a strong message that this is something that our healthcare community wants and needs.
Wonderful, wonderful. Well, I don't know if I have a network of thousands, but I will certainly be calling upon my network for that. My second question is for Senator Johnson. So earlier you spoke about trying to expand kind of the scope of services and funding them, especially specifically for adults in the setting of step-down care from acute, you know, psychiatric care to something in between outpatient. You know, something that's interesting, I actually am currently in child and adolescent fellowship. So I'm receiving training and getting a lot of exposure with kids and teens and their families. And that level of care is very, very common and well known in the child and the adolescent world. I just finished up my adult psychiatry residency training, and I had no idea that this was even an area of care. So it's just to speak to, there's a large gap between the levels of care that's permitted to, you know, adolescents and kids that's dropped off once they become, you know, 18. It's almost like they have wings and they can fly now and manage their own medications quite well and be able to leave an inpatient hospitalization and start a job and just do everything that they possibly can to pull themselves up by their own bootstraps. So if you can just speak, I guess, specifically to kind of the provisions you had in mind for that adult level of care in between inpatient and outpatient.
We are right in the middle of trying to figure out what exactly to do there. It takes a long time for the information that you just described to percolate up into the legislature. It's come to me, we don't have the solution yet. One thing that we've examined is certain types of licensure, that there are facilities that don't exist here that do exist other places because you can't be certified in anything when it comes to inpatient residential care on a short-term basis. So it may be as simple as acknowledging that this facility has met certain standards so that the insurers will be willing to pay for it because it's verified that it's quality of care and that people will be willing to enlist and enroll. And this goes for adolescents as well as adults. Other areas, it's just going to be a question of funding. And other areas, I haven't figured it out yet. And that's something politicians often hate to admit, but there's a lot of things I don't have figured out yet. But I know the problem's there now, and we will consult you and we'll consult others and we'll do our own research and we'll come up with ways to fix it. I wish I could give you a better answer and say, I've got this one solved. I don't. That's a hard one. We're going to work on it.
I appreciate your honesty, certainly, and absolutely any.
You have to be careful with that.
Well, it's still appreciated nonetheless. And we'll be happy to assist in any way, especially in terms of kind of what that clinical setting would look like. You know, we'd love to collaborate with you all.
That's how it'll happen.
Those are my questions. Thank you, guys.
I just have one comment. I don't know if there's really a question in it, But Senator Johnson, you spoke about maybe some changes would be needed in licensing in order to enable facilities to provide the treatment that those with mental illness need. And that's certainly what we've seen. And the last year, I want to say it was Senate Bill 58, opened the door for private providers to open those treatment facilities. But there was still a hang up with the budget line item allowing for payment to those facilities. And yesterday's budget indicates that whole line item has now been removed. So what can we do in terms of being sure that we're advocating for payment for those private providers and encouraging these facilities?
And Elise, your audio went out, at least on my end, for the last 2/3, but I think that I heard that there was a line item that provided for funding for that program that is not in the budget that came out a week ago. Is that correct?
That is correct.
And the question is, what can you do to try to get it back in there? The budget is an initial draft. Yeah, that budget's a draft. And it's probably a fairly good prediction of what the final will look like, but there's going to be about 1 million changes. A lot of things are going to go out. A lot of things are going to go in. What can you do to advocate for it? You can talk to every representative you can get a hold of. You can talk to every senator you can get a hold of, particularly those who've demonstrated some interest in mental health. Find out who sponsored, you say it was Senate Bill 58 or House Bill?
It was Senate Bill 58 last session.
Find out who wrote it. I hope it wasn't me because I don't remember it. And who they were working with and what their connections were. They clearly have an interest and an understanding in it. That would be a good advocate to go to the Senate Finance Committee, look at who's on the Article 2 of Senate Finance, go over to the House, see who's on the Article 2 portion of the appropriations, and start talking to them about the amount of money that needs to go in there and why it needs to go in there. But find a couple champions. I think Julie's about to jump in on this. Yeah, bring it to my attention. I'll certainly raise it with people that I think can be influential. But you want to look at people who are on Article 2 of the budget of the Senate Finance Committee and people who authored the bill last session who will not be happy if it's no longer funded.
I think that was Senate Bill 58, and I think it was the integrated care bill that Jane Nelson drafted, not last session, but a couple sessions ago.
And it could also be the complexities of the budget. It could also be that has been absorbed into a different line item. It might not be gone. So I would start with a question rather than a request and find out, is that no longer being funded? And if it is, where is it? And if it's not, why not?
Yeah, I've requested to be put on appropriations under Article 2, the healthcare section. It's part of my committee request, but we'll see. I don't know if we'll get it or not, but I'm gonna try.
Thank you.
Well, thank you all for having us.
Absolutely.
Thank you.
But
And we appreciate y'all's time, and we hope that this is obviously the beginning of a ongoing conversation between NAMI North Texas and you all. So please think of us, contact us if you need us, and we'll do the same.
Sounds great.
thank you very much. Glad to
You guys
work with you.
have a great weekend. Thank you so much.